You're listening to the Animal Free Labcast, the podcast that puts humans, not animals, at the heart of medical research. Welcome to the Animal Free Labcast, everyone. I'm back today with my co-host, Dr Gemma Davies. Hey, Gemma.
Hi, Carla. How are you?
I'm good, thank you. How are you?
I'm fine, thank you. A little bit croaky, but not too bad.
Croaky. Oh, bless you. Well, not more croaky than when I was interviewing Pandora Christie.
That's true.
Listen to the other episode, everyone. That was embarrassing.
We got through it.
We did, just about. So what have we got coming up today?
So today we're going to be joined by Dr Dania Movia, who is the recipient of our Animal Free Research UK Outstanding Scientist Award at this year's science conference we had a couple of months ago.
Yay! Very excited to be talking to Dania. She's such a star.
I know.
Well, before we get started, tell us about the poll results from last time. Gemma, I'm going to predict it's 99% of people voted one way.
Yeah, I think we're making these questions too easy, you know.
Aren't we?
So if you remember, the question was, do you think policymakers are doing enough to support animal-free research? So yes or no. And yes, Carla, you are right. The results were 99% no. So we had 3 people that voted yes, they do think they're doing enough, but everybody else thought no. So
more to do.
Yeah, more to do, always.
Always. Okay, I'm going to set us a challenge to try and get a question that doesn't result in a 99% answer.
We can try.
See if we can manage that this time. Yeah. All right, we'll do that later on.
Yeah. What's grabbed your attention this week, Carla?
Oh, wow. There's so much going on at the moment. So I've got 3 things to share with everybody. And they're all kind of policy related, but are only happening because MPs have gone to visit the labs. So it's a really lovely kind of example of how the research that supporters are helping us to fund and the scientists who are doing the brilliant work are really like inspiring MPs to get involved and to support Herbie's law. So it's just this lovely kind of interaction where everybody is playing a part. And so let me tell you the things. So first of all, Steve Race MP, he's the MP for Exeter. He has written a special article in a magazine called The House Magazine. It's a special edition of that. The House Magazine goes to every MP in the country. So 650 MPs, it's sent to all their offices. It's a special animal welfare edition. And he's written an article in that about his private member's bill on Herbie's law, all about the campaign and also about how his visit to the Exeter Arc at the University of Exeter inspired him to put forward the bill. So that's lovely to see. And we'll try and share the link with you for that as well.
Yeah, absolutely.
Then right at the end of last month, another MP, Maureen Burke, and she's MP for Glasgow North East, she visited the University of Glasgow and she met with some of the scientists at the Lifetime CDT. So the CDT is a Centre for Doctoral Training. It's a leading training programme within the UK dedicated to supporting and developing the next generation of animal-free researchers. And we're really incredibly proud to be supporting that. It's a big long-term project that we're supporting for 10 years. And during the visit, Maureen toured the laboratory and she met with the director of the centre, Professor Matt Dalby, and heard firsthand about his groundbreaking work. If you want to hear more about that, I did do a podcast episode with Matt a few years ago, so that's available. And she also met some of the brilliant PhD students that we're funding at the centre who are just the next generation. I mean, they're incredible. If you talk to them, they're such good communicators. They're really good and articulate and really passionate about using animal-free approaches. And then following the visit, she basically immediately wrote to the Science Minister, Lord Patrick Vallance, to highlight the importance of having more funding available for the development and implementation of non-animal research methods. So that's fantastic.
Yeah, that's great.
I'm going to mention her again in a minute as well. Because she also spoke in a debate in Parliament, which happened, at the time of recording, it was yesterday. So by the time you hear this, it'll be last week. So Irene Campbell, who's the chair of the APPG, she's an MP, she secured a debate in Parliament on phasing out of animal experiments in medical research. And she spoke quite late at night. It was at 9:50 at night. about the recent petition on ending the use of dogs, about the progress that we've talked about here on the podcast that's happening in the USA. And she called for a robust timetable to be introduced for a phase out for animal research, which, as you'll know, that's one of the key kind of things that we're calling for with Herbie's Law. Maureen Burke, I just mentioned from Glasgow, she also spoke about her visit to the University of Glasgow. And Navendu Mishra MP, he paid tribute to the work of Animal Free Research UK, which was just lovely to hear, and specifically talked about the Herbie's Law campaign. So that was brilliant and really great, especially because it was so late at night, 9:50 on a Tuesday evening.
Yeah,
bless them. A lot of MPs
stayed
they really
made the effort to go. Yeah, amazing.
So a minister from the Department for Science, Innovation and Technology, which is the lead ministry or the lead kind of department working on this, they had to respond. So Ferial Clark responded. She's another MP and a minister. And she repeated the government's normal line, which is improving. But so basically they think we're not there yet, but they say the day can't come quickly enough, but that the phase out has to be done in lockstep with the scientific community. We would agree with that. We need to work together. Yep. She's the Minister for AI. So unsurprisingly, she mentioned that AI would be, is potentially revolutionary way to create alternatives. Again, a lot of our scientists are talking about AI and really using that. And she repeated that as a first step to the government's manifesto commitment, they're going to publish a roadmap later on this year. And they are closely following developments in the US and in Europe, and are working with the FDA and European counterparts on this. So, I mean, our message is we don't want to get left behind. Europe and the US are doing a lot more than the UK at the moment. So hopefully this roadmap will help to redress that balance and put us back in the front. So we'll see. Obviously, as soon as that is published, we will tell you all about it. Yeah. We're not quite sure when that will be yet, but watch this space.
Yeah,
so, yes.
But that's huge. That's so exciting. That's a massive achievement.
Such a nice example of how, supporters funding, helping us to fund the scientists doing this work are inspiring the MPs to then take it to government and the government actually responding. I mean, it's incredible. I've been in this space for over 17 years and I've never seen engagement like this. It's really, I'm getting goosebumps as I'm talking about it.
No, it is. It's so exciting. It makes it all real, doesn't it? We've been talking about this for so long and we're supporting scientists all around the country, and then for that to actually be taken note of and discussed, in these situations is incredible.
Yeah.
So we've got to keep going.
Yeah. Sadly, though, it is not all good news, is it, Gemma? So you've been looking at something quite upsetting this week, haven't you?
Yeah, so this week, when this comes out, will have been last week, the Home Office has just released a new report with the non-technical summaries of animal use project licences that have been approved between January and March so far in 2025. And we were actually quite shocked at what the report contained, because in just these 3 months, over 2.1 million animals have been approved for use in experiments in Britain over the next 5 years.
My goodness. That is, I mean, that's horrendous. And it's so at odds with the government's, agenda for phasing out animal experiments, isn't it?
Exactly.
Not going in the right direction then. So tell us a little bit more about what a non-technical summary is then. That sounds sort of fancy.
Yeah, well, it's not supposed to be. That's kind of the point. So when someone puts in an application for an animal use license, they also have to put in this non-technical or sort of a lay version of the application, which is completely anonymized. So we don't know who it's come from. But it's pretty much, the only site that we really have that gives us an insight into what actually happens to animals in experiments. So, we get the annual statistics that tell us how many animals we used, but often we don't know what actually happened to them.
It's still quite secretive, isn't it?
It is, but it gives you a bit of an insight. It tells you kind of things like what the animals are going to be used for, how many animals will be used in a particular project, what kind of area or disease they're looking at, and also what happens to the animals at the end of the experiments. So unfortunately, in most cases, it is that the animals are killed.
Yeah.
Occasionally you see that they might be kept alive and reused in other experiments, which also isn't a great outcome for the animal. But very, very rarely you see anything other than the animals are going to be killed. So
yeah, there's not many that actually get a home at the end of the process.
Exactly. So it is a really difficult document to read. You know, there is some quite graphic and upsetting details in there. But if you are sort of interested in reading it, it's a publicly available document. You can search online if you look for Home Office non-technical summaries. Yeah, it would come up and you can have a look through yourself. There's 125 applications that have been approved so far this year.
Goodness. Which just in these first 3 months.
Yeah. We get this report every 3 months, so we'll see what happens through the rest of the year.
Yeah, and see if that starts to reduce once the government does publish its strategy.
Yeah.
So you mentioned 2.1 million animals are going to be used. What kind of animals, Gemma?
Yeah, well, it's pretty much everything you can think of. It includes over 1.2 million fish, over 758,000 mice, over 68,000 chickens, 37,000 rats, you know, cows, pigs, frogs, toads, everything, but also some specially protected species. So things like 83 monkeys have been approved for use and 90 beagles. So, like I mentioned, that's over 125 projects. So that means that some of the projects are really using quite unbelievable numbers just to, you know, make up the one study. So, for example, one project is using over 749,000 fish to study tuberculosis. Yeah,
That's
another
astonishing.
single project. It is, isn't it? You can't quite get your head around a number that big. But another project is using 60,000 mice to study pancreatic cancer.
Oh, dear.
And then I read through, there was another particularly nasty sounding one where they were going to surgically create injuries in sheep and then repair it to study different devices that would help to repair tendons and ligaments in 900 sheep. So it's really upsetting reading.
Yeah.
But it is worth pointing out that not all the animals in these licenses will go through these kind of nasty experiments. Some of the projects are about studying things like environmental factors. So it'll be things like putting collars on deer to track their movements in the environment and things like that. So not all of them will experience these awful experiments, but a lot of them
I think it's the vast majority though, isn't it?
Yeah.
So what about the alternatives? Because we know that to use an animal, you have to be able to justify, I'm doing inverted commas in the air. You've got to be able to justify. So are scientists doing that?
Well, this is one of the really disappointing things that you can read in these applications, because they ask questions like, why do you need to use the number of animals that you've put down? And in many cases, people have just put down something like, this is the number we've used in previous licenses, so we're just putting the same number down. And that's good enough, apparently. You know, it gets approved and that's it. So we're just carrying on the way it's always been done, and there's no pushback on that. But they also get asked about things like, what alternatives have you considered? And again, they can just get away with saying there's no good enough alternative. And I took a quote from one of the applications, which was, there currently remains general scientific agreement that to protect human volunteers and patients, non-animal alternatives do not, as yet, provide enough information to replace animal studies. So they haven't even tried. They're just saying that everybody accepts that there's no alternative and that's it. You know, and again,
looking.
Yeah. So again, that's it, and there is no pushback on it, and that license was approved. So
it's the way we've always done it. So let's just keep doing this way because there's no point checking anyway.
Exactly.
Well, that is very, very disappointing to hear. And I mean, hopefully, this is why we really need the government to be taking this on, and hopefully the strategy will make a difference and transform this.
Yeah.
In the meantime, though, there are scientists who are doing the right thing.
Yeah.
There are brilliant scientists like our guest, Dania Movia, who are choosing to develop alternatives and to use them to progress human-specific research. Yeah. So let's meet Dania now.
Welcome, Dania.
Hi, hello everyone.
Hiya, Dania. Lovely to see you.
Lovely to be here with you as well. Thank you for the invitation.
Oh, thank you for joining us. So, Dania, would you like to introduce yourself?
Yeah, sure. So, well, you have already heard my name. So I'm Dr. Dania Movia, and I'm currently an assistant professor in the Department of Biology of Maynooth University in Ireland, so aside the UK. There I actually founded and I currently lead the Humane Biomedical Research Lab. And my research team and I focused our work on developing human-relevant animal-free models for studying lung cancer and respiratory toxicity more in general. In simple terms, what we do is to try to recreate parts of the human lung epithelium in the lab so we can test treatments or inhalable substances more accurately and also more ethically without using animal.
Brilliant. Dania, thank you so much for being here, but also for the amazing work that you're doing, because you don't have to be doing it without animals. Most, a lot of people aren't. So why is doing your research in an animal-free way important to you?
Well, for me, actually, it is really, really important because I believe that animal-based research ultimately is failing patients and consumers. So really my argument in a way, it's more scientific than ethical, if we can say that.
Yeah.
Because animals are not tiny humans. They develop diseases differently. They respond differently to drugs that are targeting such diseases. But also they respond differently to the external products that, for example, are present in the air. That is due, for example, to the anatomy of their respiratory tract that is different than humans, to the fact that they, behave in general differently, that they have a fur. That also is actually a problem. So I believe that by developing and implementing models that are human-specific, we will not only embrace a more ethical way to carry out biomedical research, but we will also improve the relevance to human of the medical research that we do, and therefore we will be able to develop better intervention to finally successfully cure rather than treat patients from currently uncurable diseases like, for example, lung cancer, but also to design improved strategies to protect the wider society from, for example, toxic substances that we don't know that they are toxic. So it's really about doing better science and doing it also with compassion.
And I think that's really important, Dania, because, as people who've listened to this for a while will know, like my starting point is the ethics, right? That's, I am all about the ethics, but I think it's really important that scientists are doing this for scientific reasons.
Yes, exactly.
That is a really, in some ways a stronger argument, especially for people who aren't ethically motivated in the way that I am, that scientists like you are able to say to other scientists and to the government and to anyone who wants to listen, really, that I'm doing this because it's better science, actually.
Yeah, exactly. And there is literature, actually, that has quantitatively proven that what you do in animal, it's not reflecting human responses. That when it does, it's basically almost by chance. Really, it's about better science. It's about not failing the patients, not failing the society that trusts the science.
So have you always done your research this way, in an animal-free way, Dania? Has that always been something that, you wanted to do when you first set out on your career?
Well, the reality is really, I've never had to use animals in my research. But it is also true that when I graduated, I honestly didn't even know that animal-free research or alternatives to animal research were an option. Like most scientists, I was really trained in the traditional methods. Using animal models was considered essential in biomedical research. But then, by pure chance, I became friends with the postdoc that was working in the same institute where I was pursuing my PhD here in Ireland. And this postdoc had invented a device that encouraged human cells, to clump together and form structures that mimic the three-dimensional organization of the human tissues. And that opened like that moment really opened my eyes to a whole new way of doing science. And as I learned more over time, I became aware not just of the potential of these new technologies to create tissue mimetic cultures in the lab, and there are many, but also, and probably most importantly, the limitations of the traditional animal-based approaches. And that shift in mindset, along with a lot of learning, because there was a lot of learning, eventually led me to set up what is now my research team. So Ireland's first wet lab dedicated entirely to animal-free respiratory research. And I can honestly say that it was a challenging journey, but also very, very rewarding.
So how is your work benefiting patients?
Ultimately, the goal of my research team, just to give you a little bit of background, is to try to help the people that are affected by incurable diseases like lung cancer. And the models that we are developing and also trying to implement in our studies allow us to look at how treatments work in a way that is much more relevant to human biology, as I was mentioning before. That means that ultimately, we can hopefully identify promising therapies faster. And also, hopefully, this will deliver products that show fewer failures when the drug then reaches the clinical trial stage, so it reaches the patient. Also, we are using this model to try to monitor inhalation toxicity and treatment responses in real time and more effectively. And this could lead to more personalized treatment, which is, for whoever is not really familiar with the field, in clinics is now the new trend. Try to look at a way to treat the patient, to look at the patient rather than as a group of people and average the symptoms and the characteristic of that group of people and try to address them, rather to look at the individual as a single person. So the patient is unique. We know that every patient responds differently. So if we can look at personalized treatments in a cost-effective manner, because that is the problem mainly, then we have found a way to tackle many, many diseases.
And I think that's why we're making progress now, because there's people like me who really care about the ethics. There's people like you who really care about the science. And then there's a whole bunch of industry people that are getting on board because they really care about the economics. And together, those are three really, really powerful arguments that, you know, governments and, you know, the European Commission and the USA, the FDA, as you were talking about, they are all listening to that. Whereas we haven't necessarily before had all three arguments kind of aligning towards the same goal.
Totally. And I think that everybody can do something to help if they are interested, starting from, you know, even the patient himself or herself, that they might be curious, they might ask questions about medicines, they might ask questions on how they are developed, just to understand. They might then search what, you know, is available out there as alternatives. Speaking, you know, if you're part of a patient group, you might, you know, meet with researchers and ask them how they do. They might do things differently nowadays. You can support charities. You can support organizations that fund or advocate for animal-free research. If you're a student or or a scientist or even a policymaker, you can get involved. So I truly believe that this kind of change will happen only with small actions that come from the bottom. And I think that each of us has a role to play in shaping a different society, a society that is more humane, a science that is more humane and human relevant. And this will benefit everyone, the entire society, because as I said, and as my research team does, it's not only about curing diseases, it's also making sure that our world is safe. So making sure that we know which products or which environmental factors are toxic to us. So to make sure that, for example, workers are protected appropriately in the workspaces, you know. So I think that it will really benefit everyone.
Yeah, okay. So just to finish off, Dania, we awarded you with the Outstanding Scientist Award at our recent conference. What did that mean to you?
Oh, well, first of all, I was absolutely humbled to receive this award from Animal Free Research UK. So thank you again.
Oh, congratulations.
It stands there on my shelves in the office to remind me, on bad days when nothing works, that we are working towards a aim. And of course, for me, it was a wonderful recognition of the hard work my team and I have put into creating or in trying to create a kinder science. But more than that, I truly believe it shines a light on the movement of the scientific movement towards human relevant research and the replacement of animal studies. And it reminds me that we are part of a growing community. We are not alone. We are in this community, we are all working towards a more compassionate and effective future in the biomedical field. And what I really hope is that in the near future, thanks to the work of this community, researchers everywhere will have the tools and the support and the training that they need to move away from animal testing to embrace a innovative and human-specific science. And that is really my big aim, probably, of my career. Let's see by the end of it if I can get there.
What an inspiring vision. That's amazing. It's a brighter future for everybody, isn't it?
Yeah, hopefully.
Well, thank you so much for joining us today, Dania, and thank you from the bottom of our hearts for the amazing work that you're doing. Like, you are really pioneering the way for a new generation and showing researchers and the government that this is how research should be done for the benefit of everybody. So thank you.
Yeah.
And thank you for supporting all of this.
So good to hear from Dania. She's so inspiring, and especially when you get a week where the non-technical summaries are published and you see the horrific number of animals that are still being used. It's just really heartwarming to know that there are scientists who are working in a different way and who are helping to create the change that we all want to see in the world.
Yeah, absolutely. She's so inspiring, and it just proves that there is other ways to do things if you just try and really work towards it. So I'm so glad Dania's there flying the flag for animal-free research.
Absolutely. So what have we got coming up next time? Well, we're going to be back in a few weeks. We've got a little bit of holiday coming up. So we're going to be back on the 11th of July. And we're going to have another special guest. This time, someone completely different. We have the illustrator Emily Sutton, who is a wonderful artist. You might be familiar with her work. And she brought our vision of a brighter future to life with her beautiful drawings for our Herbie's Heroes campaign. It was the T-shirts that all the celebrities wore and the lovely bandanas and things. So you've probably already seen her work, and you'll have seen it elsewhere as well, because she's an award-winning artist. So we're going to be chatting with Emily about why she wanted to get involved in the campaign for Herbie's Law. So that's going to be really interesting and something a little bit different.
Yeah, it'd be so lovely to hear from Emily, and it'll be really nice to hear the story behind that beautiful drawing that she did that's in our T-shirts and merchandise. So
I love it so much. I want to get it made up as wallpaper.
Yeah, that would be beautiful, yeah.
I know, right? But Gemma, I set us a challenge at the beginning of the episode. Can we come up with a poll question where we don't get a 99% answer? What do you reckon?
Well, we'll see. So this...
Oh, such a scientist answer. We'll see. So considered.
Yeah, well, the question is, were you surprised to learn that so far this year, over 2.1 million animals have already been approved for use in experiments over the next 5 years? Yes or no? So, maybe people will have been expecting more or less. So we'll see what people think. But as usual, you can vote on LinkedIn, Facebook, Instagram, X, and Carla's Substack, the Animal Free Lab Stack, and we'll discuss the results in the next episode. And also, if you'd like to tell us your thoughts about the poll or anything else about the episode, please leave us a message on 0208 054 96 95. That's 0208 054 96 95.
And just remind us of the poll question once again. We will put it up on our socials. But
the question
is,
again, were you surprised to learn that so far this year, over 2.1 million animals have already been approved for use in experiments over the next 5 years? Yes or no?
And if you vote, and if you do it on the socials, do tell us why you voted the way that you voted, because that's really interesting. We'll read out some of those answers. Brilliant. Okay, well, stay part of the conversation by reading my brand new companion blog on Substack. Just search for the Animal Free Lab Substack and you can read and subscribe. I haven't done a new article for a while. Sorry, everyone, but
we've been quite busy.
I will do. No, I'm making a commitment. I will write one now. It's very random.
We'll all be looking forward to reading
something new to read. But also sign up for our emails from Animal Free Research UK as well. You'll get all the news that way too. Thank you so much for listening. Thank you, Gemma, for being here. Thank you, listeners, and thank you to Dania as well. And we'll see you in a few weeks.
See you soon. Thanks for listening. Bye.
Bye. You've been listening to the Animal Free Labcast, the podcast that puts humans, not animals, at the heart of medical research. If you want to find out about more ways to move to a world of animal-free research, then head to our website, animalfreeresearchuk.org. And if you'd like to send us an audio message about the poll or anything else you've heard in the podcast, then leave us a voicemail on 0208 054 9695. That's 0208 054 9695. Thank you for listening.